Hi, I'm Dr. Kurt Woeller. This is going to be a series of videos with respects to my experience with the therapy called Respen-A. Now, Respen-A, I've been using in my practice for approximately 1 year now. We are in October of 2010, so around this time last year is when I first started using Respen-A for a number of kids on the autism spectrum in hopes that it would help with speech, socialization, awareness, less self-stimulatory behavior, less sensory issues, etc. In that time, I've actually garnered quite a bit of experience in using this treatment. There's always more to learn, but I've been very pleased with what I have seen over this past year as far as the clinical benefits of this treatment. And just like I mentioned, from a speech standpoint, from a socialization standpoint, from a focusing and attention standpoint, from a self-stimulatory standpoint, it's been very favorable. The two main areas that I feel have been helped the most are speech as well as socialization. Now, speech means that kids have become more verbal and their language has become more complex. As some parents have described to me, as their kids' speech becomes more purposeful, it becomes more specific, more deliberate. And then the socialization aspect is kids just becoming more aware of children around them, more interested in interacting, and happier to do so. So mood has also been improved with this therapy as well. So from my experience, I can't account for anybody else, other doctors or whatnot, within the biomedical community, but from my experience, this has been a very, very helpful therapy. I'll continue to use it in my practice as one of the primary things that I've done because I've seen it be helpful for so many kids. And I would say at this point, from an approximation standpoint, from a percentages standpoint, we're talking a good 70 to 75%, upwards maybe 80% positive response rate. And from a biomedical standpoint, that's pretty good. If you're looking at the gluten casein-free diet, which generally has about a 60% positive response rate, methyl B12, which is certainly very high, in many cases upwards of 90 to 94% positive response rate, treating yeast, which is certainly very high, and other types of nutritional supplementations to kind of round out that basic format, if you will, those foundational remedies for biomedicine. In my estimation, Respen-A falls within one of the higher ranking therapies so far that I've been using now and have seen over the past number of years. So in subsequent sections of this video series, I'm going to be talking a little bit more about Respen, Reserpine, and some of the controversies that have been circulating about this therapy. So go to some of the other videos, and hopefully I'll be able to answer some of your questions that you may have about this important treatment. Thanks.